Just want to welcome everybody here first off for, as I said, this is going to be really, hopefully a very informative night for you, just some information about arthritis because, as we'll see here, it does tend to affect the majority of us as we go through life. And it is a very broad subject, so I did my best to kind of break down and get the main principles so that hopefully it will be interesting to you and not be over inundated with information. We'll talk about the really cool stuff towards the end, which will be the treatments and what really can help to make it better. So, as you can see, arthritis management and prevention. And we're looking at a nice degenerated knee joint here in the background. So we'll start out with the very basics here. Arthritis, the word comes from arthro and itis, meaning joint and inflammation of. So really when we're looking at any type of arthritis, we're looking at inflammation of a joint is really the basics of it. And you can see here from Webster's Dictionary, inflammation of joints due to infectious, metabolic, or constitutional causes. The second one I have down here is from the Free Dictionary, and I like this definition because it incorporates even more of what we really understand about degeneration and what it causes in the body. So, inflammation of a joint usually accompanied by pain, swelling, and stiffness resulting from infection, from trauma, degenerative changes, metabolic disturbances, and other causes. So there are multiple different things that can contribute to the development of arthritis, and we'll talk about some of those things, and we'll also talk about some of the resulting arthritis that we can see form. So we're going to start out very basically here. The most common arthritis that people are going to be afflicted with throughout their life is degenerative arthritis or osteoarthritis. And traditionally this is considered to be a non-inflammatory disease. But like I already said, there's inflammation associated with this because it is an arthritis. There's inflammation in the joint. So as we continue, we'll see arthritises that are actually more prone to develop from inflammatory conditions occurring within the body. So I just wanted to make that distinction for you. This isn't saying that there's not any inflammation occurring. It's just saying it's from a different source, as we'll see. The sources can be primary or secondary. You see this big word up here, idiopathic. Really that means we don't know what it comes from. But the more that we're learning, the more that we're finding out, the more we're seeing, yes, I think we actually do know what this is caused from. We'll talk about that. And secondary is caused by some other type of disorder, something underlying that can affect the development of degenerative changes in the body. So, when we look at arthritis, we look at risk factors for developing this degenerative joint arthritis or degenerative disc disease is also included within this factor, within this condition. So, when we look at them, and this is the one people think about most of the time, most people that develop an arthritis of degenerative form are over the age of 50 years. And when we look at the statistics here, people that are over the age of 55, I believe it is, it's like 80 to 90% of them show effects of having degeneration already occurring within their bodies. I've had 20-year-olds come in, though, late 20s, early 30s, and seen changes already beginning in their bodies. And they say that, I believe it's roughly 2 to 3% of people in their 20s have degeneration already beginning to start. So everybody just kind of thinks, well, this is something that is just going to happen. May as well just prepare for it. And that nothing can be further from the truth. And that's what we will get into further towards the end here. When we look at it, we look at epidemiologically and clinically. So clinically is these people are coming in and they're having manifestations, they're having pain associated with it, and we can correlate it into the degeneration that we're seeing in their spine. Epidemiologically is really the numbers I was talking about before, where I said 80 to 90% of people, and they say 100% of people over the age of 70 have evidence of degeneration. But the thing is, a lot of those people don't have pain associated with it. I don't say a lot. There's a percentage of those people that don't have pain associated with it. When I was interned down in chiropractic school in Dallas, Texas, I had a patient, we took x-rays on it, and I just said, how is this guy not in pain? He graded his pain levels at a 1 to 2, and they weren't even in the same area. He was active, he ate well, he moved, he just had a lot of things going on that were to his benefit, and so even though he had epidemiological factors contributing to saying, yes, this man has degenerative disc disease, he wasn't expressing symptoms of it, which is excellent at that point in time. So, another thing that we look at when we're looking at risk factors is that we can have genetics and epigenetic controls of this condition. So a lot of people want to say, well, my parents had arthritis, I'm probably going to have it too, degenerative arthritis. Well, looking at the statistics, as we've already talked about, most of us are going to develop some aspect of arthritis as we go through life. So is it genetics? Perhaps, but really what we have to look at is more the epigenetic controls. Epigenetics are what allows our genes to be expressed. If they are activated, then they say, yes, you're going to get this disease. If they aren't activated, then there's a better percentage, a better chance that you're not going to get this disease. So the more we can keep the epigenetics under control, the better we can keep the genetics under control. Epigenetics are very influenced by our environment, what we're eating, what we're surrounding ourselves with, what we're doing with our bodies or not doing with our bodies exercise-wise, or taking care of ourselves in that way. So you can already kind of get where I'm going with this. There's going to be a lot of lifestyle things that contribute to keeping this off and making sure that we don't have problems with it in the future. So as I said, most of you are probably starting to see that already, but we will still cover that as we go. Some other risk factors, just kind of some basic things. If you've had trauma to a joint, you're more likely going to develop, you're more likely going to have problems at that point. If you have a history of labor and physical activity, if you have a heavy job where you're lifting a lot of heavy things or doing something repetitiously, you're more prone to develop degeneration as well. Immobility and subluxation, and those of you who are patients here probably have heard this word before, subluxation. You've probably heard it a lot more than you care to. But really when we look at immobility, people that have very sedentary jobs, but we also look more on a joint-by-joint level and say things that are fixated and not moving how they're supposed to, which is a subluxation occurring within the body. That can also lead to degenerative arthritis, either at that point or at points above and below, because the other joints have to take up the slack for the joint that's not moving as well. It places a lot more stress on it. Likewise, obesity, being a little bit overweight, can also place more stress on our joints. It causes them to wear down quicker. It makes a lot of sense when we think about it. Hormones also play a role in this, and we see this because as we look at the distribution of this disease over a period of time, we see that men are afflicted with it earlier in life, usually in their 40s, late 30s, early 40s. But once women start hitting the menopausal years and their estrogens begin to shift and all their hormones start to go a little bit crazy, that's when women then surpass men and they become the more afflicted with the degenerative joint arthritis. So there is definitely some tie in there between the hormones and development of DJD as well. And then the final thing here is muscular dysfunction. If we have weakness within a muscle, if we have injury to a muscle that has affected its ability to move a joint properly, we're going to have degeneration more than likely begin in that area. So this is kind of hard to see, especially for you guys sitting in the back there. It's actually on the screen in the back too, and you can kind of follow along if you wish. But we have normal over here. We have normal muscle, tendons, cartilage, synovium, which is the fluid which cushions the joint. We have a good joint capsule going around here, and we have healthy bone. When we start to develop osteoarthritis, we start to see all those things start to go south. We start getting weakness within the muscles, within the tendons that are attaching them to bone. The ligaments that go around the bone then begin to become affected as well. The bone begins to break down itself as the cartilage is interrupted, the cartilage that should normally cushion. As the cartilage begins to break down, we also see that the fluid in between, the synovial fluid, begins to dissipate and break down and not work how it's supposed to. And then we start getting just overall gross bone malfunction, and we'll see on some of the x-rays here kind of what that looks like. But just to kind of walk you through the process there. So this is the cycle, and this is a really, really amazing slide here that I was lucky enough to find going through this process. Because what we look at here, we look at the etiology of the risk factors that we've talked about. We see the pathophysiological process, or why the disease manifests itself, why it continues and why it progresses, and then we see the outcome of this, okay? So again, I know it's kind of hard for you to see. All the ones we see over here, the risk factors, are things that we saw in the previous slide. Once we get into the pathophysiological process, we start looking, the middle of this circle here shows a bunch of inflammatory chemicals. Inflammatory chemicals are released by the body in a protective mechanism, but as we work to ignore them and not do a whole lot about it, they will continue to wreak havoc, and eventually they will begin to break down and hurt our body. So these chemicals are all here to say, hey, we need to do something about what's going on in the body. If we continue to ignore it, or we don't even perceive that it's going on, it's just going to continue to progress, get worse, and then we start all these effects begin to develop. We have nervous system sensitization, we have impairment of muscles so that people don't want to exercise, because exercise is very helpful in these types of cases. We start loading the cartilage abnormally. As I said, the cartilage is something that breaks down fairly early as these inflammatory chemicals are released within a joint. We get destruction of the cartilage matrix, the chondrocytes, the cells that make the cartilage begin to die because they aren't needed anymore. We're breaking it all down. So then we begin to remodel the bone. We start having the big bone spurs that begin sticking off of the vertebrae, off of the different joints. And then again, like I said, we get the changes in the fluid that should be there. And a lot of times what will happen is the fluid will actually just begin to dissipate and eventually disappear as things begin to fuse together. That's very far along in the progression of the disease here. But that's the pathophysiological process. The outcome of this is joint destruction. You can see some of the other things: severe pain, loss of joint mobility and functionality of the body. If you imagine if all of our joints start to stiffen up and we can't move them, just like a patient I was talking to earlier this week, she's like, oh my goodness, I can check my blind spot again. If we get to a point in our lives where we can't restore that normal motion, you imagine you're going to be doing one of these for the rest of your life. So, and that's just one example of this. There's lots of other things, and the thing I encourage people to think about is quality of life and your abilities. If you start losing abilities because of pain or because of restriction, that's not a good place to be. And what happens is you get disability, social isolation, as you see, depression, reduced quality of life, and unfortunately these people become a major economic burden to their families, to the healthcare system, and again, a lot of these things can be changed through lifestyle. If you come to our 45 Minutes to Freedom class that we do, and we go over all the costs associated with healthcare in America, degenerative arthritis is way near the top. It's within the top 10, I believe, of what diseases that are affecting our population these days that are costing us the most money. So if we could curtail this a little bit, that would be great. So when we look at the diagnosis of arthritis, there's some things we look at. We look at activity versus non-activity. Most commonly when you have a degenerative arthritis like this, it's going to hurt worse in the morning when you first get up and you've been not doing anything the entire night. But then as you get moving, the joints tend to loosen up, the muscles tend to start firing a little bit better, and it gets better as the day goes on. That is really a sign to say, yes, this is almost definitely degenerative arthritis beginning to develop. Weight-bearing joints are involved. When we look at joints, obviously knees are bearing a lot of weight, hips are bearing a lot of weight, spine is bearing a lot of weight. That's where we see a lot of degeneration begin to form. So if we start seeing problems with those areas associated with other findings in the exam, we can start to say, more than likely, this is degenerative arthritis beginning to, or has progressed to a point where it's becoming a problem. Limiting range of motion, which we touched on the earlier slide. You're not going to be able to move joints as far as you should. Limitation of function, because we aren't able to do as much. Our joints are restricting us from doing what we should be able to do normally. Again, the age ties in. If somebody over the age of 50 is presenting with these types of complaints, we're going to say degenerative arthritis. Before that, we would more than likely begin to think more of an inflammatory arthritis. So age plays a big role in the diagnosis here. History of trauma. If people have had traumatic insult to that area, they come in and say, yeah, well, I broke my knee, or I had like a torn meniscus. That is something that would say, okay, there's probably some degeneration that's already begun to occur within that joint just because of the trauma. We look and see, is there deformity? And we'll look at some pictures here in a little bit that are pretty amazing. And you'll see that there is deformity associated with a lot of these conditions. But then the other thing we look at is there shouldn't be any history of inflammatory, metabolic, or infectious processes going on, because those are all things that can also contribute to arthritic conditions, as we'll get to eventually here. So once we have this diagnosis clinically in our heads, we have to say, okay, what can we do to confirm it? One of the best things we can do is take an X-ray. X-ray will show us a lot of things. The findings that we associate normally with degenerative joint disease is that we have thinning out of a disc space, meaning that the cartilage that should be there begins to thin out, so it actually looks like there's not as much there anymore. It almost looks like the bone is starting to sit on the bone. We have osteophytes. Osteophytes are those bone spurs that develop, and we can see this should cut off right here. We see this nice little spur starting to form over the top of the femoral head and underneath here. So that's not something that we want to see. Subchondral cysts or sclerosis about the joint, it'll be a little bit whiter. As you can see, the density of the white is a little bit more intense here at the top of the joint. and then right where it makes the joint with the femoral head there in the acetabular. But then we can also actually see little vacuums, almost like little pockets where things have really begun to degenerate. We can see loose bodies and fragments, so actually little parts of the bone begin to break off and they'll show up within the joint space frequently. We can get joint misalignment, we can get joint deformity, and it becomes very apparent when people have joint deformity on x-ray, as opposed to, as we'll see some of the pictures here, are actually external views as well. So, all that, I know you're not going to be a radiologist reading these films all the time, but I think it's very interesting to see how this progresses, some of the things that you can see and how it all ties together to give you the clinical picture of degeneration. Beyond the x-rays, we can also do other types of imaging. We can do CT, we can do MRI, in some cases they'll even do some ultrasound studies, just to kind of rule in or rule out other conditions that could potentially form. But then the other thing we find with degenerative testing is that a lot of times we'll get labs run, and the labs should come back negative. They'll look at rheumatoid factor, they'll look at different antigens that should be within the body, and look at more genetic types of causes that could show up within lab work. Those should be negative because this is not related to that. So, when we look at this picture here, just isolated on the diseased joint. When I show you the whole picture here, it's really kind of amazing to see in contrast from side to side. So, we have diseased joint over here, normal joint over here. And you can see that nice disc space that's showing up here. We see there's no big osteophytes. This is still pretty normal shape, whereas this one's kind of deformed, almost like it's gone into a mushroom almost. So you can see there's not that sclerosis or the whitening about the joint either. So this is a pretty significant, a pretty severe example of a difference between a normal versus abnormal. But it's really interesting to see those changes, and you realize, like, yeah, no wonder I can't move my hip joint at all. It's pretty much bone on bone. So this is looking a little bit more at spinally, whereas we were looking at the hips before that. And again, you can see the bone spurs coming off the front of the cervical spine here in the neck. The lower neck is a very common place to get degeneration. The problem is when those bone spurs start pushing out the back as well, because spinal cord is running right through here. If we start getting some of that impingement from the bone spurs into the spinal cord, then we can start having things going on a lot further down, because we're having more neurological involvement. The spinal cord carries all the information from the brain down to the rest of the body. So if we start interrupting that, that is not a good situation to be in. And a lot of times these end up being surgical cases as they continue to progress. This is looking at a lumbar spine, so the lower part of the back from the side. And again, we see very similar things. We see bone spurs. I know it's kind of hard to see, the picture turned out a little bit fuzzier than I hoped it would, but the dark spaces in between represent where the discs should be. We can see the discs are thinning out a little bit towards the back. As we go further down into the spine here, we see that they're just thin throughout. And then again, we're having some of the bone spurs beginning to form towards the front and the back of the spine. So those are kind of the things that we look at when we look at spinal x-rays to see, is there degeneration going on within this person's body? So I talked to you a little bit about other types of arthritis that we can get and how we differentiate them. This is a list of some of the other ones that we can get. We have inflammatory, and a lot of these are considered to be autoimmune conditions as well. So the body's immune system is actually fighting against and almost destroying itself because it recognizes our self-tissue as being something that it's not. It's saying, this isn't supposed to be here, we're going to get rid of it. And that's what we get in rheumatoid arthritis. That's the most common inflammatory arthritis that we'll get. Scleroderma, systemic lupus, those are conditions which are more, when we look at these affect more than just the joints. Somebody with scleroderma or lupus or psoriasis, a lot of times we see them manifest with different skin lesions that they can get, because it tends to affect far-reaching areas, not just at the joints. So the rheumatoid, scleroderma, systemic lupus, psoriasis. Most of you probably know somebody with psoriasis. They get kind of that silvery scale, almost like a white plaquing over their skin, but it can also lead to degenerative changes as well, as we'll see here. I have a nice picture coming up soon. Enteropathic arthritis. Entero is referring to the intestines. Pathic meaning there's a pathology of the intestines or disease of the intestines, and it can in effect cause arthritis. Usually it's connected to Crohn's disease and ulcerative colitis. inflammatory diseases of the bowel, which are also considered to be autoimmune. So more than likely there's some correlation between we're having autoimmune going on here in the digestive tract. It's also going to affect the joints different places. Ankylosing spondylitis, again, is another inflammatory arthritis, usually seen more in younger people. And then Reiter's syndrome and reactive arthritis. This is arthritis that we get specifically in reaction to specific infections that people will deal with. So, but not to be confused with septic arthritis, which we see down here is another type that we can get. And this is actually from an infection that develops within the joint as opposed to an infection that develops somewhere else and moves to the joint. So a lot of times the septic arthritis will happen after you've had a surgery or after you've had some sort of wound to an area, and then bacteria gets in and actually works its way into the joint and inflames it and begins to degenerate it. So again, not a very fun situation. These are a little bit more serious arthritis to deal with. The crystal deposition diseases, your gout, your CPPD, and your hydroxyapatite deposition, your HADD, these are all diseases that usually involve metabolic processes going wrong. So you start taking things that should normally be soluble within the body's fluids, they become insoluble, and you start developing crystals. Crystals are not comfortable when you get them in soft tissue, like your cartilage, like the muscles, the tendons, everything that goes around the joints. So these are very painful in most cases when you have them begin to develop. And again, gout is one of those things where it's more of a widespread type of illness, and you can have more far-reaching effects, especially in the kidneys can be affected with that. So when we look at, oh my goodness, there's all these different types of arthritis that we can have. So how do we really go through and differentiate these inflammatory ones now? We got the osteoarthritis down, how we differentiate that. But what we have to look at for the rest of these are the other physical exam signs. Again, we look at the age of people to see some of the, like I said, some of them affect people over, younger people over older people. We also look at the physical exam findings here. And of course, we're going to take a comprehensive history from this person. If they say, I have, a gut issue, and I have this pain, a lot of times we can make that correlation and say, okay, well, let's get you tested for some of these other things to see if that could potentially be causing the arthritis that you're dealing with. But we can also look at things like nail and skin texture. Like I said, with psoriasis, a lot of times we'll get some skin manifestations, and we'll also get a lot of times pitting of the nails. I know it's kind of hard for those of you who are sitting a little further back here, but there's actually little dots where it's almost just like gouged out of the nail beds here. So that's one thing we can look at. Temperature. This joint here looks a little different than the one on the other side. If you would go in and feel this joint with the back of your hand, you'd say, wow, this one's a lot hotter than the other side. And not only that, it's more swollen. This is somebody who has a septic arthritis. They have an infection within their joint that is eating it away. Almost 100% of the time you're going to find that these things are inflamed. But you also have inflammation around the joint. It'll feel warm and tender with rheumatoid arthritis as well. Gouty arthritis will also present the same way. So you have to, again, you have to look at all the predisposing underlying factors. You can see that there was probably a little bit of an injury here to the leg that may have then spread and continued on to the joint. So we also look at deformity because certain arthritic conditions show up with different patterns of deformity. I'll show you some examples of those here on upcoming slides. Excuse me for a second. It is warm outside, and it is warm in here. I apologize for that. Hopefully you guys are staying comfortable, not too comfortable, of course. But, okay, so differential diagnosis continued here. We have x-rays that we'll look at. We look at the sites of involvement. This picture here shows us, kind of like I told you already, that osteoarthritis will affect specific joints over other joints because it'll affect more weight bearing. Other arthritises also have that same type of distribution. Like rheumatoid arthritis, it really likes the joints here, the bases of the fingers. It won't move much more further than that, but it can. But if we see it here, a lot of times we can say that's more than likely rheumatoid arthritis. If we see multiple joints involved in the same hand, we can say, okay, maybe this is more from a psoriatic type of presentation. So we also look at the symmetry. Is it symmetrical from side to side? With a disease like rheumatoid arthritis where it's systemic, it's throughout the whole body, a lot of times it'll affect the joints on this side, it'll affect the joints on the other side as well, equally. Whereas osteoarthritis might pick out this joint here, and this joint here, and the hip joint. So some of them will be more selective than others, and they will present with different signs when we take x-rays of things. And again, the laterality. Is it one side or both sides? Will also be able to give us some hint as to what it is. But some of these diseases, and this is the coolest part, it's actually really sad, but they present with different types of signs. When we look at this one here, it's kind of hard to see, but what we learned in school is this is a gull wing deformity. So you can see it almost looks like when you draw seagulls on a picture, it's got kind of that V indentation into the distal interphalangeal joint here in the finger. And when we look at this, a lot of times we can say that's some sort of erosive arthritis that's developing, a lot of times enteropathic arthritis coming from the digestive system. When we look at a spine like this, we see calcification of the ligaments on each side of the spine and also right down the middle. And that is called a trolley track sign. And we say almost 100% of the time, this is going to be ankylosing spondylitis. So it's kind of cool to be able to look at these things, but unfortunate for the people that are dealing with them. But they all do present with very individualized types of signs and symptoms. So for further testing, we can do the labs. I already mentioned to you the RA factor. That's something that will show up in rheumatoid arthritis, or what we call seropositive diseases. And there are a few other ones that will also show up as being positive for that as well. But then a lot of them will, the majority of the time, show up as negative. So then we can then rule them out if that's positive. HLA-B27 is a human leukocyte antigen, which is, again, it has some genetic predispositions associated with it. So people that have this, when we do testing on them, we can say you're more prone to develop these types of diseases, but not these types of diseases. So uric acid is another one. Uric acid is what we check for people with gout. If you have hyperuricemia, it's going to be affecting your joints almost for sure. If not, it's going to at least be affecting your kidneys. So, and then inflammatory markers. And inflammatory markers will show up on most of these, even the osteoarthritis, if it's far enough progressed, if we do like what we call a C-reactive protein, which measures inflammation, or a sedimentation rate, those both can give us an idea if there's inflammation occurring within the body. And again, of course, we can do advanced imaging. We can do CTs, MRIs, and as I said, we can do ultrasound will show some of these conditions very nicely. So, take a look at a couple pictures here. This is rheumatoid arthritis. This doesn't look at all comfortable, does it? That is what we call a swine neck deformity, and it happens, again, we see deformities that are very specific to some of the conditions that we're dealing with, because, like I said, we're dealing with joints, but rheumatoid will also affect the ligaments and the muscles here in the area too, and can cause contractures like this to make the finger do that. When we look at the knee joint here, we see that there's equal loss on both sides. When we look at osteoarthritis, if you remember back the very first slide I had up with the knee on it, it was more towards the middle side of the joint. This one is pretty equal, so that again points to say this is probably rheumatoid arthritis. And there's also this nice huge soft tissue swelling off to the side that's showing up on the film. So we see all those things connected to that. This is the deformity I'm talking about. And this, again, you thought this didn't look comfortable. This looks even worse. You can see we have swelling here of the joints, especially here at the metacarpals, right where the fingers run into the palm. And you can see they're starting to deviate, what we call ulnar deviation, so they're all going this direction towards the outside of the wrist. And what we see here, when we look at the x-ray, is we see those joints being affected here. They're eroding, they're degenerating, almost looks like they're dislocating. And you can see all the fingers are starting to go that way. And that's a very telling sign that this is probably rheumatoid arthritis that we're dealing with. Psoriatic arthritis, some interesting things we see here. We see what we call sausage digit. And again, that's one of those things we see externally. And we take a look here internally, look at the bones, we can see all the bones are beginning to degenerate. And there's some certain radiological signs that we'll see with psoriatic arthritis when it begins to develop. But again, you can take a look at these nails here. For those of you I know kind of far away, you can't see it, but they are nasty looking. And a lot of times you'll get that pitting and it'll get really nasty looking. So again, you can kind of tie those in to give you some good clinical pictures. This one takes you back a little bit. This one is that gouty arthritis. Very, very painful. You get those crystals deposited within the joint. Not a fun thing to have to deal with. You can see the severe inflammation that this person is dealing with within their hands. And you can also see here on the x-ray the soft tissue swelling, the big gray areas around the joints, and just the dissolution, the absolute breakdown of the joint occurring there. That is not anything too comfortable to deal with. So if we can avoid this, this is going to be a great thing to avoid. Oh. So I didn't show you pictures of everything because I know you guys don't want to see them all, but I know that some of those were very interesting to me as I was going through and making this presentation, and I hope that it was interesting for you because a lot of times you'll see these on people and you'll be walking around and be like, that's not right. And you can actually say, yeah, this person probably has some sort of arthritic condition they're dealing with, and unfortunately all you can do is kind of feel bad for them at that point in time. Once it gets so far advanced, there's not a whole lot they can do except for trying to manage it. So that's what we're going to get to right now. The traditional management versus the alternative management. So this is the exciting stuff. So first we'll look at the traditional because it's much more boring and not very fun to deal with. So what we're looking at here, you're either going to cover it up or you're going to take it out. That's really the things that they will look to do from a traditional medical perspective. Not to say every practitioner will be like that, but that is the majority. People are starting to move towards alternative types of therapies because they have been found to be more effective. But what we look at here, we're going to do pain management, which a lot of times can include some sort of analgesic medication. A lot of times they'll do these both together. You can see steroids. Steroids over the long run are going to suppress your immune system, and they're going to also affect your bone density. They're going to work to decrease it. So these aren't things you can do chronically, but a lot of people take them chronically. They'll also do steroids a lot because, like I said, a lot of these are immune conditions, autoimmunity. If we can kind of calm the immune system down by giving you a steroid, well, that's going to help you feel better, sure, but you're also going to be more prone to infections, and again, you're going to be more prone to becoming osteoporotic, and it's really not helping anything because that underlying process is still occurring without taking care of what is underlying causing this. Surgical, you can see some examples here. That doesn't look like it should be there, neither does that. Replacement here of a knee and also replacement here of a hip. And both of these are probably the most common joint replacements that you'll see. But the unfortunate thing with these are they work really well for a period of time. But usually they have a life of about 10 to 15 years. Then you're going back and you're redoing it over again. And if you develop this arthritis early on enough in life, you could be looking at, 2 or 3 hip replacements. So something that we definitely want to try and avoid if at all possible. Sometimes, as you saw with some of the joints there, they'll also get some constrictures or some restrictions in the muscles, and sometimes they'll go in and they'll just release those surgically. But then another therapy that they'll use is just immobilization. They'll say, well, if it hurts to move it, let's just not move it anymore, which is, again, going after the symptoms that you're dealing with, not necessarily taking care of the underlying cause, because a lot of times movement will help depending on what the underlying cause is. So, this is a really interesting picture I found. It was somebody who done a research paper, and it was about the different things that we do for degenerative arthritis and how well they work. And this is just kind of progression. We start here at less invasive, work our way to more invasive. So we have weight loss and exercise, then we started adding in acetaminophen, COX-2 inhibitors, NSAIDs, intra-articular hyaluronic acid injections, intra-articular steroids, and joint replacements. But the thing I want to point out to you here, and for those of you sitting in the middle, you're not going to be able to see this, but we have the acetaminophen being a weak analgesic, COX-2 inhibitors, inadequate pain relief, they will provide some, but we get GI complications because this will go in and it'll start tearing up your gut, and this is where you start getting a lot of GI problems, complications, concerns. NSAIDs, they cause a lot of GI bleeding. So we're like, okay, we have all this going on, but at what cost? We look at the hyaluronic acid injections into the joint. They're really weak, and they really haven't proven efficacy of them yet. They're kind of a new thing, and so we're still kind of waiting to see how those will all pan out. And then the steroids, disease progression. That's what we see here, because again, the steroids don't do a whole lot except for they will reduce some inflammation, but they don't have a nice long-term effect. Because what we're going to eventually end up with doing here is joint replacement surgery. So the thing that is pointed out here is that there's no disease-modifying effects for anything in here, except for the weight loss and exercise and the joint replacement surgery, which I think is very interesting. Because this is really what the results of this show. Poor and healthy gut function from some of these different medications we're taking will likely lead to progression of the disease without much to show for it. So we might be able to manage things a little bit here and there, but unfortunately, at what cost? You're sacrificing our ability to digest, potentially developing anemia problems because we're bleeding into our bodies. So just not the way we want to go with it. That's why we prefer people seek the alternative management. Those options are always there for people if they need them. If we can't work with them on a more natural plane to help them with what they're dealing with, we can always go back to that. But we always say, let's try in something even less invasive. Weight loss and the exercise, that's really what we start out with. But here is the goal for alternative management. The overall goal is just don't get it. Let's see what we can do ahead of time. Let's start in your 20s, your 30s to try and not get this problem in the future. But if you do get it, let's go after the actual cause of why this is happening. Not just say, let's throw some medication at it, see what we get out of it. Probably a bad digestive tract. So, the goal cannot be to alleviate pain alone. If that's the case, then we can just go over to the traditional medical model and go from there. So we have to look at the actual cause. We have to look decreasing inflammation and increasing mobility as we decrease the inflammation. So that's just kind of the basics of what we do with alternative treatment. And you can see decreasing inflammation I have down here. We have ice, heat, therapeutic modalities, nutritional, weight management, and a lot of these I'll get into a little bit more depth here. Ice and heat though. Ice is really good for acute inflammation. So when you're really feeling the discomfort, ice is a great thing to do. If you're working more to fire the muscles appropriately, get them calmed down and relaxed, get the muscle moving a little bit better, increasing the range of motion, it's good to warm the area up. So do some moist heat. Whatever modality you like to do with that, whether that's getting a hot shower, a hot tub, warm towel, all those types of things are therapeutic and can help reduce pain, increase range of motion, and also help the muscle calm down. Therapeutic modalities, that would include things more a physical therapist or some chiropractors would do in their practice, but would include also exercise, but it could also be things like electrical stim therapy, ultrasound, different types of things like that, paraffin baths, all those things fall into those therapeutic modalities. But then we get into the increasing mobility. Optimal joint position is very important here, because if you have a joint that's fixated or not moving how it's supposed to, if we can restore that normal motion, a lot of times that will help the mobility to increase and remove some of the stress from the joint and decrease the inflammation. So that's a great thing to do, and I think chiropractic is a great way to do that, increasing specifically the joints that are subluxated or fixated. But when we get into exercise, we get into stretching exercises, but also strengthening exercises. We'll talk about those, I believe, one of the slides coming up here. So, but again, that's just kind of the basics, the overview. This is a little bit more advanced explanation of what we're talking about here. So, we'll talk about healthy movement here first. The first, as I said, exercise. So what we start with doing in these conditions is we don't want to throw you in and have you doing bench presses and deadlifts and all those very heavy types of weights that actually be counterproductive. So we have to start easy. Passive range of motion exercise, so somebody else is moving your arm, somebody else is moving your finger, somebody else is moving your hip. When we do isometrics, where the muscle isn't changing length at all, you're just using the same muscle tone the whole time. Alright, I should say you're using the muscle staying the same length, just like we see in the picture here. This guy is doing some isometric exercise, so he's just doing some pressing, and you just change the tone within the muscle. And then this is where flexibility comes in as well. When we look at more advanced exercises, then we start to do the active range of motion. So rather than somebody else moving your arm around, moving your hip around, moving your finger, whatever it is, you're going to start doing it on your own to try and help you increase that mobility. The more movement we can get, the more your body says, hey, we have a joint here, let's help it out some, let's send circulation to it, let's send neurological flow to that area. It can be very helpful. And then also isotonic, so you can start adding in more of those things where you're actually changing the length of the muscle and actually putting more range of motion into the joint while strengthening it. So that's the exercise portion of it. Chiropractic, as I already described, is what we do more localized and trying to really pinpoint down what's not moving the way it's supposed to, so as we restore that motion, it's going to help that joint to be healthy. Healthy detoxification. I know one of you attended my detox class I taught here in January. I don't know if anybody else did, but there's so much we could go into it. I have one slide on it here. I could spend 40 or 50 slides just talking about detoxification. There's a whole presentation that is online. If you go to our YouTube page, you can find it there. If you don't know how to do that, you can talk to me afterwards and I'll get you hooked up with that. But the healthy detoxification is really important because a lot of these, especially the autoimmune, the inflammatory diseases, are tied in with the inability of the body to be able to cope with the oxidative stress, the toxic stress that's coming in. So doing a detoxification program is a great way to help reduce your toxic load and also to kind of get yourself back into eating properly, as we'll see here in a few slides. That's very important to helping maintain your overall health and wellness and decreasing inflammation. So I have just a couple of products up here. We use the Ultra Clear product from Metagenics. They have a couple different types that we use, and then also the AdvoClear to supplement with that, and then also the Clear Bite through Apex Energetics is a product we started carrying here recently as well. Both of them very good products for working on detoxification. Next thing that we have here is healthy immune system. As I said, some of these are autoimmune conditions. So if we can keep the immune system healthy so it's not attacking its own tissue, that will be a very nice thing in a lot of these circumstances. So we have the autoimmune components to a few of them. One of the things that they've been finding recently that's really helpful with modulating immune system response is this product here. It's called a proline-rich polypeptide, or we abbreviate it PRP. And it's actually been shown to help balance out, like I said, the immune system, but it's also shown a lot of neurological conditions get improvement with it, using it as well. Because it has some neuroprotective effects, it also has some immunoprotective effects. If you can keep your nervous system and your immune system healthy, you're going to be a good, healthy person for a number of years to come. So, and probiotics, and you see probiotics are down here, they're also under healthy gut because these both are very highly integrated. But probiotics are very important. You can see the UltraFlora Plus dairy-free that we use here in the clinic. It's very important to make sure that we have good bacterial colonization within our intestines, because if we don't, then we start developing a whole host of other problems, and we oftentimes see autoimmunity developing as a consequence of this. It's not out there, it's out there in the literature, but it's not readily accepted yet. We're kind of a bit behind when we're looking at autoimmune conditions, but really this is what they're finding, is that if we don't have good gut flora, if we don't have good gut permeability, good absorption in the intestines, we're not going to be healthy people. So with a healthy gut, we want to avoid allergens. A lot of people have allergies to food that they don't even realize it. They're just like, well, yeah, when I go get something here, I eat this. Every time I eat it, I feel awful afterwards for about 3 or 4 hours. More than likely, unless it's something really greasy or really nasty, you got McDonald's or Burger King, something like that, you may have some sort of food allergy associated with it. If you can correlate and say, every time I eat tomatoes, I feel awful afterwards. Some people will say, I actually get joint pain. There's actually some correlations there. So what we recommend people do with this is you can do something like a detoxification program and then do an elimination provocation diet after that. So you cut down your diet to a very minuscule amount of foods, and then you start reintroducing them one at a time to see, when I reintroduce this food, does it cause a reaction? And if it does, then you know not to eat that food. Another thing you can do is you can actually do food allergy testing, a little bit different than your normal allergist would do, and they will react your blood with certain antigens and see if it has a reaction to it or not. So if you want to know specifically and not go through that whole process, then you can look into doing that as well. But again, we need to keep the gut healthy because it is very strongly tied into our overall health. Healthy stress response here at the very bottom, and psoriatic arthritis, actually psoriasis outbreaks are very tied into stress. So keeping your stress response normal, or as normal as it can be, that's going to be very important. And again, we did a previous workshop about this. I believe Dr. Lindholm did it, and it was a really good workshop. It should give you some really good ideas of what you can do, supplemental-wise, nutrition-wise, but also just some good techniques to help control your stress on a weekly basis. So, the 3 arrows here, I put this on the slide, I put them all together because I already kind of hinted at the fact that these two go together, but so does this one. All these have to work together. A good stress response, a good gut, and a good immune system. The majority of our immune system is contained within our gut. That's where we get a lot of the the exposure to a lot of the things that we deal with in immune system when we start talking about sicknesses and bacteria, fungi, those types of things coming in. But then we also have the stress. If we're chronically under stress, we're not going to be turning over our tissue as well, including our intestines, which have to turn over very, very quickly. It's also going to affect our blood sugar. It's going to affect our microflora, meaning our bacteria that's within our digestive tract. So if this isn't working well, everything else isn't going to work well either. All these things, as I said, so strongly tied together, and so often we try and look at the body as this system and this system and this system. They all work together. You can't affect one without affecting the other. So that's why I put those three together here on the same slide. Now, healthy diet. This is where we really get the building blocks for making good cartilage. If you're feeding yourself a bunch of junk from fast food or processed, stuff from boxes, you're not getting good building blocks, and you're predisposing yourself to developing arthritis because your body's like, what am I supposed to do with this? I can't make cartilage out of this. So, and you almost have to think about it like that. Everything we take into our body is incorporated, and it has to be eliminated. Same thing with detoxification. If it's something that our body doesn't recognize as being a food, it has to work extra hard to try and get rid of that. So the more that we can follow this proper nutrition, balanced diet, moderate and healthy calories, more produce driven as opposed to being more, if you look at some of the foods we eat these days, you read down the ingredients list and you're just like, my goodness, I don't even know what half this stuff is. Probably more than half of it. Whereas if you look at a banana, you're like, this is a banana. So it's like, is this a bunch of foods put together, or is this a whole food that we're eating here? So, and one of the principles of this follows is along what we call a paleo diet, and some of you may have heard of a paleo diet. Really what a paleo diet is kind of what you see here. And it's not a perfect representation, but it was as good as I could find to show you. But really it follows a diet of, say, what would more primitive people have eaten? What would, people 300-400 years ago have been able to get their hands on? Well, definitely not a Stouffer's, that's for sure. So, I mean, these things are what we should be eating. Not parts of foods, not chemicals intermixed with our foods. It should be foods. The body knows what to do with those things. It doesn't always necessarily know what to do with those other things. So, so again, paleo diet, if that's something you're interested in, it's really good. It's not vegetarianism or being vegan. There still is meat incorporated with it, which I think is very good. So, some of the other things you can do diet nutrition-wise, avoiding purine-rich foods, especially if you know you have a predisposition to developing gout. If you have a family history of that, you want to try and stay away from those. So these foods are going to be your red meats, your organ meats, really anything that has a lot of protein in it can eventually get broken down into a purine-containing compound. Another thing is alcohol is known to really aggravate gout. So avoiding that, you can see down here, that's my next suggestion. Gout and psoriatic arthritis, both those will oftentimes flare up when you have alcohol. Healthy weight, we kind of talked about that already. If you take the weight off, you're going to take a load off the joints, and the joints are going to be very thankful to you. So incorporating a lot of these along with the exercise, the only byproduct of that should happen is becoming a healthier weight. So all those things should work together to give you that. And adequate water. A lot of times we can just get dehydrated. Our discs, all the fluids that I was talking about between the joints, we need to have water to be able to replenish those. As well as we need water to be able to flush out all the toxins, to dilute some of the things that get within our blood. So we need adequate water, and a lot of us are not very good about drinking enough water. So getting towards the end here, because we're getting to supplementation, and these are some of just the basics of what you can do. Again, we need good building blocks, and one of the places we can get good building blocks is from glucosamine sulfate. And this is something that is very, very important if you know you have degenerative arthritis developing. We can a lot of times start to work to head it off, because this is actually what the body incorporates into the cartilage in order to make it form. So if we can supplement with this and help increase the body's availability to it, that's going to be a good situation. Now, some people will say, well, there's glucosamine and there's chondroitin. Chondroitin is derived from a different source, and from what I've read on it, is not as absorbed. So you have to take a whole lot more of it in order to get the same results, and you're still not going to get as good as incorporation into the body as you would like. So that's why we recommend people go more with the glucosamine. Fish oil, if any of you have been around this practice for a period of time, you probably know that fish oil is good for you. Pretty much anything, but especially for inflammation. That's really what one of the main tie-ins with fish oil is, and we'll see on here on the next slide. But it helps to decrease that inflammation that develops within the body, but also the fluidity of cell membranes. And they're finding that our cells all have this coating around them, and they're finding out now that they think that it's actually one of the ways that the cells communicate with each other is through the coating and different things that they will present on the outside of the coating of the cell. So if we don't have enough fish oil, if we don't have that fluidity, that movement that we need, it can definitely affect that transmission, but also just the health of the cells overall. Last thing on this slide here is the antioxidants. Antioxidants are going to help reduce inflammation. I shouldn't say it. They're going to help reduce oxidative stress on the body, which will help to reduce inflammation. If we can get rid of those reactive oxide species, those things that are wandering around and just tearing up different areas of our body trying to balance themselves out chemically, if we can give them antioxidants to give them something to steal from, then it's going to be a much better situation. We're not going to just take away from our bodies restores. So this is that slide I was telling you about, and this looks kind of crazy. The thing I want you to look at here, we have omega-6 acids, fatty acids, and we have omega-3s. Omega-3s are the ones that are considered to be more health-promoting. Omega-6s, if we follow down the pathway here, they can be diverted in what we call arachidonic acid. Arachidonic acid is very inflammatory, and the omega-3s and the arachidonic acid will compete for binding sites on the cells to say, yes, we're going to cause inflammation, or no, we're not going to. So the more omega-3s we have to combat this, the better it's going to be. You can see the omega-6s can move into anti-inflammatory pathways, but things like insulin, statins will fire into this pathway and make it so that it will start driving towards inflammation as opposed to anti-inflammation. So there's a lot of things that occur within our bodies that we're exposing ourselves to. Like I said, the environment is going to cause us to go this way, pro-inflammatory cytokines and interleukins being produced. This, as you can see, fish, omega-3 meat, wild game, omega-3 fatty acids in eggs. Those things are going to feed into the EPA and the DHA and be the anti-inflammatory chemicals that will help to combat this whole process. And you can see up here, we have green vegetables, chia, flax, and hemp, and there's loads of other things that can do it as well. So you can see we have nice healthy stuff over here as opposed to corn oil. We got some gluten, some wheat, some potatoes, all fried. Yeah, so all those things, again, driving more towards inflammation.
So important not to eat fried foods then, is that correct?
It is.
Okay. Yeah. Now what about the farm-raised tilapia and catfish? Is there something, is it because it's farm-raised, or is it because there's something in the fish that really isn't?
With farm-raised, if you imagine you have all these fish kind of swimming around in their own filth all day. Yeah. They're going to be exposed to it for one, but they also have a higher potential for developing, getting mercury, heavy metals within them. At that, rather than catching them in their actual environment and eating them there. But that's a very good point, that those fish can, you have to make sure that your fish oil is from a good source. The stuff that we sell here, we know is from a good source, but if you buy fish oil that's sitting out on a counter somewhere, it's not being refrigerated, or it's not stabilized with an antioxidant, and you open it up and you're like, oh man, if you don't want to take it, you probably shouldn't take it. When you open up a can of our or a bottle of our stuff here, it doesn't smell like fish at all, and it shouldn't. It's once it starts to go rancid, that's when it becomes bad. Or again, when you have bad fish that you buy, and unfortunately, fish is just getting ridiculously expensive now, especially if you get it not farm raised. If you get it actual caught from the sea, I mean, I've seen it like 15, 16 bucks. It's kind of outrageous. So I don't even like fish, so I'm fine with taking a fish oil supplement, which, you know, you get one of those for like, I think it's like 30 bucks. So, but it will help to promote this. But like I said, fish oil has been, I mean, they've implicated it in cardiovascular problems, even things like cancer, immune problems, not just inflammation in the joints here. Even though inflammation is a major cause of a lot of those other things, it really has very good protective effects on the body, and that's why we recommend most people get on one. So yeah, enough about that slide. There's a lot on there, as you can see. All those pathways. I didn't have to worry about those once I left school. So, finally here, we have a little bit more supplementation. Trace minerals. Your zinc, your copper, your boron, your magnesium, and your manganese. All these things are going to be cofactors in different reactions that have to happen in the body to give you good cartilage, but also to oxidize and get rid of junk that will get into the body. So that's why the trace minerals are important. B vitamins will accomplish much the same thing, and B vitamins are very important for neurological health and also for your stress health as well. Hormonal types of things, just everything, very, very, very important with those B vitamins. And then the bromelain, the curcumin, the turmeric is derived from turmeric, and then also ginger. These things are natural things that you've probably heard of most of them. Bromelain maybe not, because bromelain is just a different, it's a name for some enzymes that naturally occur within pineapple. So if you're eating pineapple, you're going to be getting some of this. If you eat things that have turmeric in the spice, you're going to be getting a little bit of this, although one of the best ways to do it is actually getting it through, we have a product, there's a couple different products out there, but one of the ones that we've tried before is the Tumoro Active, and it's actually a suspension that you take. It's like a syringe, and you just squirt it in your mouth, and it has the turmeric in it. But these are shown to be very, very potent anti-inflammatories. They've actually put them up against some medications, and the medications are actually don't work as well as some of the natural alternatives. And the good thing about natural alternatives is that there's really no possibility for developing toxicity to them, or for developing bleeds or anything like that that are associated with a lot of the other medications that we could potentially deal with. So yeah, that's kind of the basics of supplementation here. As you go through and read online, or do some more research on it, there is so much more that you can find. But this is some of the stuff that's been tried and true and is known to be effective. So as we close up here for the day, it really comes down to this. And you can kind of see this. This is a whole trend as we're going through this presentation. If you eat healthy, it's going to help a lot of these things not even have the opportunity to develop. So pretty much all the slides I just talked about with what you're eating, what you're supplementing your body with, those are very, very important things to look at prevention, but also at the treatment aspects. So very, very important. But the other thing is this. You got to get moving. You got to do some sort of exercise. As I said, it doesn't have to be much. We can start with very basic things and then start working into things a little bit harder. This is really where the rubber meets the road. I've given you a lot of things that you can think about, that you can work towards, and the doctors here, those of you who are patients, we love to be able to help you out through these situations we might be dealing with. If you have further questions, we'd love to be able to answer that. And if you have any specific questions about some of the supplementation measures or the exercises, if you think you might have some of these things beginning to develop, you have a family history of that, let us know, and we can begin working towards trying to alleviate that. So that is it. I appreciate everybody's attention here this evening, and I hope it was a good night for you guys, and hopefully you got a lot of good information that you can now begin to use in your life and be able to make it better.